Hi everyone, I'm Christy. I'm here to do part 2 of my series of feminist therapy videos. I am each day this week going to do one of 4 core principles. Yesterday I did the personal is political. Today I'm going to do the idea of egalitarian relationship in therapy. Before I start this, I wanted to add that there's a lot written about feminist therapy. There's a lot to be seen. I will at some point put together a short list at least of resources. And I say that just to make clear that what I'm doing here is just kind of my views on these points. They are not exhaustive or definitive. Anyway, so today I'm going to talk about egalitarian relationship in therapy, or the idea of reducing or mitigating power imbalances in therapy. In a lot of traditional therapy approaches, especially when you go back in time, there was very much a sense that the therapist was this all-knowing, powerful person, I guess, who would, listen to your problems and then tell you how to fix them and fix you. That's been greatly reduced over time in general. Within feminist therapy, we actively try to reduce that impact. And we do so in several ways. And these are some of the ways that I do it. First, you might notice that I don't use the term patients, I use the term clients, because I think patients denotes a more medical, a more hierarchical structure for working with individuals. Clients isn't necessarily perfect in that respect, but I think it's a little better. So that's the one I use when I have to use it. Otherwise, most of the time I just say the people I'm working with. Second, and this is more universal for feminist therapy, we do talk about therapy as being the meeting of two experts. The therapist, who's an expert on techniques and interventions and listening and trying to make some assessments, and then the client or the person they're working with, who is the expert on their own life and who they are. And it really requires both of those in order to have an effective therapy relationship and to get the outcomes that you would like in therapy. The next big area, sorry, I do have to keep glancing down at my notes here to remind myself what I was going to talk about. The next area is on trust building. When I start working with a new client, I don't assume that they're going to trust me and be willing to share everything in their life with me on day one. And I try to say that expressly. I do forget sometimes. That I'll ask a lot of questions going into the work. I don't expect them to necessarily feel comfortable answering everything. I do hope that as we go along, that they will. And I've seen that happen on a number of occasions, where something the person didn't really want to answer the first session. 4 or 5 in, they were willing to talk about. And that connects also to the idea of the use of self, which is another big area in therapy. And again, when you go back in time, there was this idea that the therapist didn't use anything of themselves in the session. They would never disclose anything about themselves. And there are still some, especially in my view, people who practice Freudian psychoanalysis are more likely to maintain that kind of a therapist as blank slate or blank screen or whatever you want to call it. Most approaches allow for some use of self, particularly when it's for the benefit of the client. I also think some use is appropriate in terms of building the relationship, building the trust. When I was in school and we were learning about this, like specifically when people would ask you a personal question, how do you approach it? And the most common response was to deflect it by asking, why are you interested in that? Why is that something you want to know? I personally think that it's rude to answer a question with a question, so I would not approach it that way. I decided from the start that if a client asks me a personal question, I'm going to respond to it. I'm not necessarily going to answer. I'm not necessarily going to provide the information. If nothing else, I will say, that's something I'm not comfortable sharing, or I don't think it's appropriate for me to share that. Or I might just share it. And then, very possibly, I will go into asking why they are curious about that. I think that's perfectly fair. Another big area where this idea of reducing the power imbalance comes in is having an appreciation and understanding of confidentiality. Now, of course, all therapists understand and appreciate confidentiality to some degree. I have experienced both in school and in practice that there's varying degrees of understanding and appreciation. I start from the perspective of recognizing that anything the client tells me is kept in absolute confidence. The default is that I do not share it with anyone. And then, in the first session with clients, I will explain what some exceptions to that are, including being in clinical supervision with another therapist and sharing some information with them. Understanding that confidentiality extends to them, and I also don't share enough that they can actually use it. Also, mandated reporting. That's another area where it's required. The risk of self-harm or harm to others. I will discuss and disclose those limitations to confidentiality in the first session with a person. But I also very much seek to understand those boundaries myself. And, again, going back to the idea that the default is I do not share it. And that if I'm going to share it, it's going to be because there's a reason. Sometimes because the client wants me to share it, that there's some benefit to them in sharing it. Sometimes because it's legally required. But I want confirmation that that legal requirement is a real legal requirement and not just what somebody believes is. Anyway, I could go on much longer on that topic, and maybe someday I will do a separate video on that one. But I think understanding the boundaries of confidentiality, understanding and appreciate it, is vital to recognizing and respecting the autonomy of the client. And so that, to me, also contributes to this idea of reducing the power imbalance between clients. Okay, so tomorrow I'm going to continue with another section. I think tomorrow I'm going to discuss privileging the experience of clients in therapy sessions. So I look forward to putting that together and getting it out there. In the meantime, if you or someone you know is interested in therapy and this sounds like an approach that would appeal to you, I am available for sessions for adults based in New York, either living or working in New York. I can take most major insurances. There's more information in the link in my bio. Thanks, and have a great day.